Yes, good morning, and you're watching Morning Dew on Juson TV today. I am still your host, Conrad Anekan Reginald Macaulay, and today we are having the medical superintendent of Judiciary Staff Clinic. Please, ma, can we know your name and who you are actually?
Thank you. I'm Dr. Rosemary Akpan. I'm the
Okay.
medical superintendent of the Judiciary Staff Clinic.
Whoa. So nice meeting you, ma. We firstly want to say thank you for, giving us the privilege to have you live on Juson TV. So, we not intend to keep you for a long time. What is the vision of Judiciary Staff Clinic?
Thank you for that question. Judiciary Staff Clinic, it's a health facility
Okay.
and its vision is to meet the health needs of the staff of the judiciary and also the public as well, to
Okay.
provide counseling, treat conditions, follow up patients.
Okay. So, from what I've just heard now, that means Judiciary Staff Clinic is not just meant for staff alone. We can also have patients coming outside for treatment. Is that what you're saying?
Yes, we also attend to the public apart from the staff of the judiciary
Okay,
and also the nearby ministries around.
okay. Wow, that's because at the time we are just thinking it's just for staff alone that other people cannot come in. Thank you for giving us that clearance. So we go to the next question. When did this creativity come to be? Like when did they open judiciary staff clinic and how did it come about?
Judiciary Staff Clinic has been on for the past 6 years.
For the past 6 years?
Yes, it was opened on the 8th of October
Hmm.
2019 by the immediate past governor of Akwa Ibom State,
Okay.
Mr.
Udon
Udom
Emmanuel.
Emmanuel. Yeah.
Wow. That is nice. You said 6 years, and there are some people that doesn't really even know that we have a place like this. Okay, they might just see the name, but they have not been there before to know what is actually happening there. Okay, fine. What are the benefits of this clinic, to the staff, considering the name Judiciary Staff Clinic? What's the
Well,
benefit and how can we the staff participate in whatever is happening here?
the Judiciary Staff Clinic has a lot of benefits to
Okay.
the staff around. Apart from giving them the opportunity to check their vital signs, their blood pressure, doing some investigations like checking their blood sugar and other investigations like malaria parasite, urinalysis, and all other. It also gives them opportunity to treat their medical conditions and also in cases of emergency, they are also treated. I've seen cases of people collapsing in courts and they were rushed in there and resuscitated. If there wasn't a facility like that,
Diabetes.
there would be delay in getting to
And
proper
that could have
health
lead to,
management.
yeah. Okay. Wow. So that's good. Let's also dig in a little bit around it. What is the how could I put that? As in the financial side of it. Are we the staff paying, or if we're paying, is it a kind of a full pay, or I don't know if you understand what I mean. When it has to do with money and health now. Yeah. Brief us a little bit on that.
Well, the payment is really minimal. A card in the clinic is worth just 500
Yeah, that's
naira
what we
for a
wanted to
whole
hear.
year. For
And that's from
yeah.
January to December, just 500.
And most government-owned clinics pay the same. So with
Okay.
that card fee of or registration fee of 500, you can be attended to for the whole year, and then you renew the next year with just 500. So it's very, it's very affordable.
Okay. Wow, that is good. So that is almost being run like normal government clinic outside in
Yes.
terms of the cards and some other. Then how about the drugs? How do you get your drugs? Are you funded by the government, or how do you get your drugs
I would
and some
say
other things
yes,
you
because
need?
the drugs are from the central drugstore owned by the government, where
Of
all
Akwa Ibom
government
State.
facilities get medications from.
Okay, okay. That's
So they
that's
are also very affordable.
okay. That's a good one. That's a good one. So you can see, as a staff of judiciary, you can access Akwa Ibom State Judiciary Staff Clinic for your health conditions and other diseases. So briefly, can you brief us on the kind of ailment you treat? Like do you treat malaria and you know let me leave it because I don't want to start mentioning things I don't know. So I'll leave it to
We
you.
treat all conditions within the ambience of the facility we have. We treat malaria and every other condition. But this is more or less a primary level of care. If
Okay.
the conditions are beyond the capacity of this facility, we give first aid and refer appropriately to either secondary level of care or tertiary level of care, depending.
Okay. That's good. That's good. So I believe you are also learning as you're watching Jusam TV. Thank you very much, ma'am. So is judiciary staff clinic, affiliated with the National Health Insurance Scheme? Yes. I think they call it NHIS. Yes.
Well, for now, not yet, because this National Health Insurance Scheme has been brought to the state level just lately. I think it
Okay.
was launched last year, if I'm right.
Okay.
And so it has not gotten to the judiciary staff clinic yet. But we are hopeful.
That sooner it will be.
Yes.
That's good. So what could be your advice to the staff of Akwa Ibom State Judiciary in line with their work and their health, and how can the facility be useful to them?
First of all, I'd want to tell the staff of the judiciary they should take their health more seriously,
Okay.
and that, you know, when they are ill, they should make efforts to seek medical care. And also, they should check their numbers from time to time, especially now that you have a health facility right here in your premise. Check their blood pressure, also do their blood sugar from time to time, and ensure that they are fit. That's the
Okay.
advice I would like to
That's
give them, because
that's
they are not really maximizing this place. I'd like to say
okay.
even the outsiders are benefiting more
Than the staff.
from this clinic,
What
the
could be
presence
what
of
could be
this
the
clinic.
reason? What could be the reason? Is it that there was no proper information or announcement, or why is it that the outsiders are benefiting more than the staff?
Well, I don't know if it's a matter of not being informed, but I think most of them know the clinic is here,
Okay,
so they should just work on their health seeking behavior. And when they
okay,
are ill, even in the place of work, they should seek for health care.
okay. So you have a lab here that you run tests and all those things.
Yes, we have a lab that runs a couple of tests or investigations. We do malaria parasite tests, we do whiteout tests, urinalysis, HIV serology, hepatitis B and C assays, and a host of others. Even though we don't have all the machines for all the investigations,
Okay,
but we have for some. And if we need to do investigations that we don't have the facility, we refer them to where they can get these investigations.
okay. Wow. Thank you so much.
You're
Thank you so
welcome.
much. We really appreciate you coming on our TV to really help us brief us on this very
Thank you.
facility. Finally, before we let you go, what is the challenges you think the facility is facing, or what do you think the government or the management of Akwa Ibom State Judiciary can do to step up the job delivery of the facility?
Firstly, um, they need to publicize the presence of this clinic so that the staff would maximize its use. Then secondly, there are a couple of other investigations that or tests that can be done here if the machines are provided. like full blood count. The machine is quite expensive, but if it's here, the staff will benefit.
Thank you so much, ma, once
You're
again.
welcome.
You're still watching Morning Dew on Tucson TV View, and my name is still Comrade Anakan Reginald Macaulay. Thank you very much for watching Tucson TV. Okay, you're still watching Tucson TV View, and right now we are here in Judiciary Staff Clinic. We are about to see the facility, and then we brief you deeply on the activities of this facility. Follow me now. Okay.
And this is one of our lab scientists.
Okay. Good afternoon, ma'am.
Good afternoon, sir.
Hi. Thank you. You're watching this on TV.
Okay.
Thank you.
Our treatment room.
Treatment room.
Yes.
Right. Okay, this is nice. The clinic is actually
Ouch.
on a good point. Yes.
That's the office.
Okay. This is the admin office.
Yes.
Okay. And we can see the doctor's office here.
And this is our second consulting room and also the office of the medical superintendent.
Okay. Wow. So you have seen it all. This is judiciary staff clinic. What it looks like. Okay. Yes, we are still in the judiciary staff clinic, and we are also talking to one of their staff here. Please, ma'am, can we meet you? What's your name and who are you here?
Okay, pharmacist person, pharmacist in charge of judiciary staff.
Okay, so we are talking to pharmacist who doesn't. Please, ma, can you brief us a little bit on how your department in this clinic is helping and also being useful to the clinic, possibly your challenges and your advice to the staff of the state judiciary about this clinic and your department too.
Our role here is to, of course, dispense medication to our patients, our clients on daily basis, and of course, counseling on how to take the medication. That's our main goal here. Of course, other sectors of the clinic will also perform theirs and now send the patient to us for dispensing of those medications and of course follow up counseling and the rest.
Thank
Yes.
you so much. You are still watching Juice on TV.